Welcome to Primary Care Today on ReachMD. I'm your host, Dr. Brian McDonough, and with me today is a very interesting guest, Dusty Eber. He founded PatientStyle. That's a line of high-quality patient apparel with the patient in mind. It provides comfort without compromising medical function, including nursing gowns. This is really interesting stuff because you got a physician and health provider audience, and there's probably a lot of people out there, Dusty, who even as clinicians say, some of these gowns, some of this really is a day which should have passed a long time ago, and we all will eventually see ourselves in these if we haven't already. What's your thought? How did you get involved? Where did you come in with this in mind and decide to make a difference?
Thank you for having me on. I saw that there was a real need in the marketplace for comfy, cozy hospital gowns that dealt with modesty, dignity issues. There's a famous movie called Something's Gotta Give with Jack Nicholson where he's walking down the hospital floor with his backside exposed. And we see that. We see a lot of that in hospitals today where patients are wearing two gowns. So we wanted to create a product that there was a full sweep in the backside, and you didn't have somebody having to wear two gowns, and it really dealt with their, modesty, dignity, comfort issues.
Now, your background, I must admit, I don't know a lot about PatientStyle or even the history of how the gowns got to where they are now. That was one of the reasons I wanted to interview. Your background in design, in clothing design, and is this something you fell into, or is it something you personally said, I want to change?
Good question. So my background is in apparel, accessories, home products, primarily for retailers. And about 4 years ago, made a switch over into the healthcare side and thought that we could make a big difference, and we have.
And is it really taken off? I mean, are a lot of hospitals picking up? From what I read, it appears that you do have clients throughout the country.
Yes, it really has. We're with many of the U.S. News and World Report top hospitals. When we launched, that was our focus about 4 years ago. We were going after hospitals that were really focusing on patient experience, patient satisfaction. The hospitals such as the Stanfords, the University of Pennsylvania's, the Sloan Ketterings of the world, and that was our original focus.
Now, when you put them together, you obviously probably have learned, if you didn't know already, the history of the standard gown. How did we ever get to that point? I mean, was there a functional reason for why the gowns are the way they are?
That's a very good question. We believe that hospital gowns probably haven't changed in over 100 plus years. And we haven't really been able to find out why there wasn't innovation or really any changes in the hospital gowns. A traditional hospital gown is made in a woven fabric. So it's a little bit of a stiffer material, and ours is more of what would be called an interlock fabric. So it's like comfortable pajamas that one would purchase, at a Macy's of the world.
I think about this, and it's one of these things, and I'm sure you probably have people say, like, I worked in healthcare all my life. I should have come up with something like this. It's such a natural idea. It's like Christopher Columbus. How do you get the egg to stand on the side? Oh, you hard boil it, you crack it, and now it stands. Now you know the secret. It's easy. Did people come into this before and try and fail, or are you the first person who's decided to venture into making it a little more stylish and perhaps a little less embarrassing?
To our knowledge, we really haven't seen other companies out there. There are some retail products that one would find, let's say, as a nursing gown for new moms, but not product that would actually hold up in industrial wash. So we really haven't come across anything or seen anything. And to your point about folks in healthcare saying, wow, why didn't I come up with this? We hear that all the time. Nurses are great designers, and they've given us a lot of inspiration and direction on how best to, move things forward and create great product.
And I will say physicians are great at being thieves of scrubs. And I remember when my wife and I were first getting together, meeting and things, she came over, sees my place, and she says, gee, do you have anything but scrubs around here? And I remember at that time, before there were a lot more rules and concern about infection and everything else, doctors loved the scrubs. I mean, they were great. They're pajamas. They're wonderful. You can wear them to go work out. It was a wonderful thing. You don't see that anymore because of the realization that they need to be where they are for a functional purpose in a hospital setting. But the scrubs were something that people would wear out of the hospital. They were fashionable, yet the patients were stuck with something that more or less you wouldn't be caught dead in.
Exactly. And today, there are surveys that patients are filling out, as I'm sure you're well aware, when they leave the hospital, called HCAP surveys. And those are tied into the patient experience, the patient satisfaction. And we're seeing, even just in the 4 years since we started the company, there's a lot happening around everything from chef on demand to the valet parking to the concierge services, really bringing a lot of the hospitality pieces into healthcare.
If you're just tuning in, you're listening to Primary Care Today on ReachMD. I'm your host, Dr. Brian McDonough, and I'm speaking with Dusty Eber. He has founded PatientStyle. That's a line of high-quality patient apparel with the patient in mind. And you really have expanded, and you're working in different directions. Do you see this going beyond just the gowns into other things, maybe like scrubs or other types of hospital apparel going forward, or has it already?
We started with the adult gowns, and then we moved into the pediatrics. So we saw that was a big need for kids to be able to wear, comfy, cozy patient gowns. In terms of expansion into other product categories, yes, we're looking into things around linens and sheets and towels and all of that.
Now, where are you guys based?
We are based in Northern California, outside of San Francisco.
So then you distribute throughout the country. Have you seen, again, I'm the medical guy, not a business guy, but have you seen growth in your own company as this has developed as well?
Tremendous. There's been a lot that has happened in healthcare over the last 4 years, obviously, and we're seeing, because, as I mentioned before, patient experience, patient satisfaction being so important today, even tied into some of the government reimbursements that are coming back into the hospitals. Patient experience is a focus of every hospital today. So yes, we're seeing tremendous growth, everything from the 25-bed rural hospital in Iowa to some of the very large 1,000-plus hospitals in the top cities in the United States.
I serve on our hospital's medical executive committee, and you're so right. I mean, at one point, it might come up periodically, but they now will talk about the surveys, the HCAPs, all of these things, the quality metrics. It's really starting to infiltrate, I'm sure, the boardrooms as well as MedExec and the other areas. And you are onto something because people will complain about the food being hot. They'll complain about their comfort level. And if they do, that can really impact the hospital scores.
Exactly. It's a tremendous amount of money, potential money, dollars, that can come back into the hospital if done correctly.
Now, when you're talking about this and you're talking about a company like you have and reaching out, are there people resistant? I mean, you might call or your representatives speak to hospitals and they say, listen, we don't need this. This is ridiculous, or it's too expensive, or are you finding it overwhelming acceptance?
Good question. So we see that there definitely are people out there in the healthcare community who are hesitant from afar. But as soon as they see the product, they feel the product, they say, wow, we need to figure out how to do this in our hospital. How do we have this product for our patients?
You bring up something interesting, too, which, I wouldn't have thought of. Obviously, you're in the business, but you have to have that industrial strength product. It has to feel good and look good, but at the same time, I mean, I'm sure the hospital washing machines, industrial, it's probably pretty rugged, and they have to withstand a lot of heat and temperature and all the different things that go into it.
Yeah, exactly. The product has to hold up, as you were saying, in industrial wash, and there's regulations around temperature and what can go into the industrial wash to make sure, the product is cleaned properly. And one of the important functions of the product is that this is a reusable product, so it needs to hold up to multiple washes in the industrial wash, so our product will, in fact, last well over 100 washes.
What's your favorite product right now? I mean, if you're going to say there was something that is most widely accepted, what's the one that kind of gets people, they said, oh, we love this?
We have a few that are very, what we would consider innovative. We have an amazing mammography top that the healthcare community has just, jumped all over. That is one. We've also, from an innovative standpoint, we've developed a nursing gown, again, that deals with modesty, dignity, and all those comfort issues. A third one, which I would just put out there, is we've also developed a modesty gown. Modesty from the standpoint of individuals who would like to be covered up a little bit more, whether it's in the length of the gown to the ankles or down to the sleeves. And that could be for preference of, or even from traditions or from a religious standpoint.
And I guess you probably, we're running out of time, but knowing you're in the business and you've probably seen it, one of my favorite Seinfeld episodes is the one where Elaine doesn't want to wear the hospital gown in the doctor's exam room. Have you ever seen that?
Yeah. Very funny.
It's classic. But what it shows, again, is that people are aware of this and they're maintaining their dignity and trying to do things. And you see that I think you've caught on to something that's important for people. And for me as a primary care doc, family doc, I like the idea of making people feel as relaxed as they can and not feel awkward, because that's just one more barrier to communicating and getting the information you need as a physician. So I applaud you for your efforts. I think it's much needed, and I want to thank you really for taking the time to join us on Primary Care today, Dusty. It's a different show than we normally do, but I found it fascinating and very interesting. I wish you the best of luck.
Thank you so much for having me on, and I really appreciate it.
This is Dr. Brian McDonough. If you missed any of this discussion, you can visit reachmd.com/primarycare today to download the podcast and learn more about the series. Thanks again for listening.